Well, good afternoon, and consistent with what the the governor suggested, is that we continue to work to expand eligibility for our citizens. And as we look at getting allocations of more vaccine into West Virginia, we know, as the governor said, that the discipline of our approach related to getting first shots and second shots in arms of our nursing home residents, which we were the first in the country, and our targeting our elders, our Save Our Wisdom campaign, as the governor said, has been very, very effective in reducing our weekly death rates over time to over 80%, as the governor said, and also reducing our hospitalizations dramatically from over 800 to now less than 200. So as we look at the additional groups that we know through Centers for Disease Control have higher risk of both dying and getting hospitalized with COVID-19, we have extended that list. And Jordan, I don't know if you have the slide you could put up. That's great. I can't read that, but I do have the additional list on my screen. We will extend this to West Virginians 16 and over for the Pfizer vaccine and 18 and over for Moderna and Johnson & Johnson vaccines who have the pre-existing diagnoses of asthma, diabetes mellitus, chronic kidney disease, heart disease, immunosuppression, lung fibrosis, chronic obstructive lung disease, blood disorders, liver disease, neurological disorder, high blood pressure, and chronic infections with diseases like HIV. In addition, as the governor said, we will extend the eligibility to all essential workers, irrespective of age, given their frontline status and helping make sure that we keep our businesses open, keep our hospitals and clinics open, keep our utilities working, and perform the other vital services and functions that are so important to West Virginia in schools and business. So that will be in all ages. And as we go forward, as President Biden has asked us to commit to have vaccines available for all Americans by May 1st, we are committed, as the governor said, to follow that. This weekend, as the governor's instructed all of us to do, we keep in contact with national connections that we have developed. And we know in Europe, they're seeing the third wave of COVID-19, generally fueled by the United Kingdom variant of COVID-19. We know in West Virginia, we only have 4 identified cases so far of the United Kingdom variant, but in some states like New York and Florida and Texas, we're seeing growth in the United Kingdom variant. And we know that this variant is faster to infect people and may make people sicker. But we also know that this variant is absolutely taken care of by the vaccines that we are using. And therefore, despite opening up to more people, which is fantastic because all the people that we've included are at higher risk to get seriously ill or die from their infection, we also want to make sure we maintain our discipline and we are taking care of our elders first and the people in our medical illness categories that we know have increased risk of dying and being hospitalized. So while we open up, we appreciate the patience of each West Virginian who is now eligible. We want you to get vaccinated. We want to protect you. We want to protect all of West Virginia. So thank you for what you're doing. Keep wearing your mask, stay physically distanced as people are getting vaccinated. But I think through the leadership of the governor and the commitment to make sure that we are opening West Virginia carefully, but maintaining our vigilance and our good behaviors as we are all getting vaccinated, that's the way that we're going to see this through and help West Virginia continue to be a beacon for the rest of our country. Thank you.